Good afternoon, everyone. I am Dr. Shweta Garg. I am working as a senior gynecologist at Care Partners Mother and Child Hospital located in Sector 2, Panchkula. So today I am going to discuss on management of the fibroids. First of all, what are fibroids? Commonly known as fibroids, but in our terms it's known as leiomyoma. So, fibroids are the most commonly encountered benign tumors of the uterus and they are commonly encountered in the reproductive age group. So, how will you diagnose the fibroids? The diagnosis of the fibroids is made on ultrasonography or they can be diagnosed on MRI, but the most common diagnostic modality used is first the clinical palpation and then the ultrasonography. If there is some doubt in the diagnosis, then when we can proceed with the MRI as it is the most accurate modality in assessing the adnexal tissue. Now, what are the commonly encountered symptoms in the fibroid and when the treatment is required? Now, majority of the fibroids are asymptomatic and only 20 to 50% are clinically symptomatic. And most commonly encountered symptoms are abnormal uterine bleeding, iron deficiency anemia, or it can have pressure symptoms like constipation, or the patient can experience increased frequency of micturition, backache, or there can be reproductive issues, mainly the infertility or inability to conceive. Now, the treatment of the fibroids is mainly individualized. That means the treatment is required if you have symptoms and it depends upon the size, location of the fibroids, your age, whether you want to preserve the uterus or not, or whether your fertility is required or not. First of all, what is expectant management? That means कब तक आप ये चाहोगे कि कोई ट्रीटमेंट की ज़रूरत नहीं है, यू कैन जस्ट वेट एंड वॉच. Now, if you have mild symptoms and you are approaching menopause, that means your periods are stopping. You know, you are in an age group of 40 to 50 years when we expect that you are approaching menopause and you have just mild symptoms. Then you can wait with the supportive treatment because it's seen that in 3 to 7% of untreated fibroids, they regress in 3 to 6 months in postmenopausal women. But if you have severe symptoms, then you may require the treatment. Now, various options for the treatment are medical management and the surgical management, and another upcoming is minimally invasive techniques. First of all, the medical management. Now, the medical management is generally considered for a short term period. It is not considered for long term cases as well as a permanent management. Now, if you experience pain during periods, then we can prescribe you simply the painkillers, in which NSAIDs are the commonly prescribed drugs. And if you are experiencing mild increase in the blood loss, that means from the normal you experience that there is slightly increase in the blood loss, then antifibrinologic agents like tranexamic acid can be given to you. The benefit of these drugs is it can be given only for 3 to 4 days for your periods, and in rest of the cycle there is no need for further treatment. This is only for the mild cases. But if you have another symptoms or the side effects or the symptoms are severe, then we can consider another medical management. In this comes oral contraceptive pills. These are generally given to control the bleeding. This will not decrease the size of the fibroids. It can be given for 3 to 6 months, generally to control the bleeding. If you have symptoms like menorrhagia, that means excessive bleeding, then we can prescribe you the oral contraceptive pills. But The treatment depends whether you want to conceive or whether you don't want to conceive. You just want to have preservation of the uterus and you just want to buy some time for your before the surgical management. Then next option for the medical management is the progesterones. They can be given in the form of pills, they can be given in the form of injections, and another commonly used is the intrauterine device, which is commonly comes by the name of Mirena. This can be inserted for 5 years, but this is only used in those cases where the fibroids does not distort the cavity. जैसे कि आपका फाइब्रॉइड है बट वो कैविटी को डिस्टॉर्ट नहीं कर रहा और मेनली आपका सिम्टम है increased bleeding during the periods. Just to control that, we can insert the Mirena, and if you don't go for want to go for the hysterectomy. But if it is not possible that if you want to have babies or you want to conceive, then these are not the treatment options. Then another drugs which are given is the gonadotropin releasing hormone agonist, in which the commonly used is the leuprolide injections, which are given as monthly injections. But now, what is the role of these injections? They lead to temporary menopause-like state. That means it will lead to stoppage of your menstruation. There will be no menstruation when the leuprolide injections are given, and this will correct your anemia. This will lead to improve in your hemoglobin levels. And third benefit of these drugs is that it will lead to the reduction in the size of the fibroids. So these injections are mainly considered in those patients who have big fibroids and in which we are want to do the myomectomy. Before proceeding for the myomectomy, these injections are given to decrease the size of the fibroids and to improve the myomectomy outcomes so that the blood loss is less. Obviously, agar size decrease hoega तो the procedure will be much more easier. Secondly, these injections are given to those patients who don't want to go for the surgical management and want to buy some time. So this is the another treatment. Then another treatment which can be given is the aromatase inhibitor, which is letrozole. Now this drug is the side effects are very less. It's given in the dose of 2.5 milligram daily for 3 months. So it is seen that it leads to the reduction of size as well as it leads to the control of bleeding, and it can be safely given. But it's not the permanent solution. After the stoppage of drugs, there will be revert back in the increase in the size or your symptoms after 3 to 6 months. So they are not the permanent methods, they are the temporary methods which can be given. Then another drugs which are used are pro- progesterone receptor modulators, in which come mifepristone, which is given in a daily dose of 2.5 milligram for 3 to 6 months. So this will significantly reduce your uterine fibroid size and helps to relieve the symptoms, especially menorrhagia. Now, mifepristone is mainly purely antagonist to the progesterone. Another upcoming drug which is used commonly these days is ulipristal. So this is the selective progesterone receptor modulator, which is given in a dose of 5 to 10 milligram daily for 12 weeks. Therapy is indicated, and it is effective when we compare it with the GnRH agonist. It is equally effective in controlling heavy bleeding, but it is not much helpful in decreasing the size. The size reduction as compared to leuprolide is less, though the size reduction is seen up to 20%, but it is less as compared to leuprolide. So these are the medical managements which are commonly available and can be prescribed. So in short, if I'm saying that medical management, it is basically to buy time for mild cases and for those cases where we are planning myomectomy but the size is very large, to decrease the size to uh, for the better outcome of the surgical procedures. So these medicines are prescribed. but these are not the permanent cure. Now, the permanent cure are the surgical methods, in which mainly comes myomectomy and hysterectomy. You must be aware. Now, what is myomectomy? As the name suggests, myomectomy is just the removal of fibroid. हम इसमें सिर्फ फाइब्रॉइड निकालते हैं, यूट्रस नहीं निकाला जाता. एंड दिस इज फॉर दोज पेशेंट्स हु वांट टू प्रिजर्व uterus, or who want to conceive. And the infertility, for the infertility, fibroid is the reason behind them. So myomectomy is performed. Now, myomectomy can be performed by various routes. You must have heard कि open कराया हमने, laparoscopy कराया. So it can be performed laparoscopically, it can be performed by open technique, or it can be even performed through hysteroscopy. Hysteroscopy के through हम नीचे से vagina के through hysteroscope insert करते हैं and we can remove the fibroid. But hysteroscopic removal of the fibroid can only be done if your fibroid is present into the endometrial cavity. अदरवाइज फॉर अगर वो वॉल में है यूट्रस की या यूट्रस के बाहर है, it cannot be done with the hysteroscopy. Then the routes preferred will be abdominal route and laparoscopic route. If we compare both the routes, obviously laparoscopic route will be the preferred modality, as it reduces the hospital stay, it reduces the blood loss. But before proceeding for the myomectomy, it should be clear to you that during myomectomy, there will be chances that it can be converted into hysterectomy to prevent the blood loss. Sometimes बहुत ज़्यादा blood loss होता है जिसको control करने के लिए hysterectomy ज़रूरी हो जाती है intraoperatively. Secondly, even after myomectomy, it is seen that 15% cases में fibroids दोबारा grow कर जाते हैं at a new site or at new rate. So दोबारा से आपको या तो myomectomy करानी पड़ेगी, या in 10% cases ultimately they will have the requirement of hysterectomy. In hysterectomy, generally, it is the removal of the uterus. It is a permanent cure, because अगर uterus ही remove कर देंगे, then there will be no further recurrence of the fibroids. Now, hysterectomy again can be performed by different routes, which can be by abdominal route, by laparoscopy, or it can be performed vaginally, depending upon the size of the uterus and your surgeon's preference. Laparoscopic and vaginal route are better as compared to the patient compliance and post-operative care. Another techniques which are nowadays available are the conservative techniques. These are minimally invasive techniques in which the commonly practiced is uterine artery embolization. Though it is practiced in some centers, it's not available in all the centers. But in this, they will inject some gel into the feeding vessel of the fibroid. मतलब जो blood supply है fibroid की basically, उस आर्टरी में एक जेल को इंजेक्ट किया जाएगा जिससे कि ये सप्लाई रुक जाएगी. So ultimately the fibroid will decrease in size, there will be necrosis of the tissue. Though इस टेक्निक के बाद the patient is discharged after 24 hours, and the patient will have, the uterus will be preserved, but in some cases amenorrhea persists. That means आपकी नॉर्मल मेंस्ट्रुएशन नहीं आएगी किसी किसी केस में, बट ये नहीं है कि आएगी ही नहीं. एंड देयर आर लेस चांसेस कि आपका फर्टिलिटी, दैट मीन्स अगर आप कंसीव करना चाहते हो तो शायद आप कंसीव ना कर पाओ. सो इट इज़ नॉट प्रेफर्ड मॉडलिटी अगर आप कंसीव करना चाहते हो. सो दिस इज प्रेफर्ड अगर आप नॉन सर्जिकल मैनेजमेंट चाहते हैं और अपने यूट्रस को प्रिजर्व करना चाहते हैं. Another upcoming methods are focused energy delivery systems, in which we focused on the ultrasound, MRI guided ultrasound frequency is delivered at the site of the fibroid. But these are the upcoming fields. So in short, if I explain, so there are three managements expected if the symptoms are very less and you are approaching menopause. Second is the medical management. Medical management is generally considered if your symptoms are mild, or you are approaching menopause. Thirdly, if you want to buy some time before going to surgery. Third is the surgical management, which is the definitive management of the fibroids, in which comes myomectomy mainly and hysterectomy. If you want to preserve the uterus or you want to preserve the fertility, then myomectomy will be the choice of treatment. Or if you have completed the family, then the definitive treatment will be hysterectomy. So if you have any queries, then you can post your queries. I will answer the questions. So I can see one question that how can we treat the fibroids? So as I've already explained, treatment of the fibroids depends whether आपको कोई problem है या नहीं. If you have no symptoms, then the expected management is followed. That means you will require no treatment unless and until the size is very large. Otherwise, no treatment is required. They can be left, and we can just examine you after every 6 months to 1 year to see in any increase in the size of the fibroids. Then the treatment, if you have symptoms, the treatment depends upon whether you want to conceive, whether you want to preserve the uterus or not. If your symptoms are mild, then the medical management can be offered to you. But if the symptoms are severe, then depending upon your age and depending whether you want to preserve the uterus or not, myomectomy or hysterectomy can be planned. Complications can be for the fibroid. Uh, if you're 35 years old, it depends whether you want to preserve your uterus or not. Generally, less than 40 years of age, we want to preserve the uterus, and in those cases, the treatment will depend upon the uh, symptoms, basically the your symptoms. And complications, in what regard you want to know about the complications, whether for the surgical or the medical management. So if you please can be specific. I can see that you're asking about the complications. But I just want to know if you are asking about the complications with the medications, with the expected management, or with the surgery. Cost of the treatment depends upon the mode of the treatment. The medical management treatment cost depends upon which medicines we are giving it to you, and surgical treatment usually costs for the hysterectomy. It depends upon the hospital to hospital, it varies. If you are going for the laparoscopic hysterectomy, it usually costs between 70 to 80,000. And if you are going for, I'm talking about my hospital, I'm not talking about the other hospitals. And if you are going for open hysterectomy, the cost will be around about 50,000. For the myomectomy, the cost will be around 60 to 70,000. Now, I'm taking up the next question, which is what happens if the fibroids go untreated? Now, if the fibroids go untreated, slowly and slowly they can increase in the size. That is why the follow up is required. Now, if you have a very small fibroid, say 1 to 2 centimeter, generally it does not lead to any symptom and no treatment is required. Just the follow up is required. If you are achieving menopause, इसका मतलब है कि अगर आपका menopause आने वाला है और आपके periods बंद होने वाले हैं, आपकी एज ज़्यादा है, so it will, if there are no symptoms after menopause, the size of the fibroids will decrease. There is only 0.26% chances कि ये जो fibroid है, which is a benign tumor, it can convert into malignancy. But उसके अलग से symptoms होते हैं, एकदम से size increase हो जाएगा, pain होएगी, आपको symptoms महसूस होंगे. Otherwise, fibroids, if they are asymptomatic, they can be left as such. No, fibroids cannot come out as clots, but if you are experiencing clots, इसका मतलब है कि आपको bleeding ज़्यादा हो रही है, which can be due to fibroids, and you need treatment. So after checkup, the treatment modality, after checking, after discussing your age, what is the size of the fibroid, what is the location of the fibroid, we can discuss the treatment. So passage of clots is generally कि आपको ज़्यादा bleeding हो रही है, which can be due to fibroids. Fibroids cannot come out during periods. They can be seen only in one case. अगर आपका फाइब्रॉइड एंडोमेट्रियल कैविटी के अंदर है और वो नीचे प्रोजेक्ट कर रहा है, कई बार क्या होता है कि वो पॉलिप के फॉर्म में नीचे प्रोजेक्ट करता है, only then you can feel the symptoms and you can sometimes see the something coming out of your vagina. If they are in the cavity, if they are not in the cavity, they are outside the uterus, or अगर वो wall में है uterus के, they will not come out during periods. Again, the best treatment for fibroids, if you are asking, the permanent treatment is hysterectomy, but it is not preferred in those cases who are younger and in which we want to preserve the uterus. And another modality is myomectomy. But if you have mild symptoms, then the medical management will be the preferred mode. So, best treatment basically depends upon your age and your symptoms. Now, if you have small fibroids like 1 or 2 centimeter, then we will not recommend hysterectomy. We will just advise you to wait and watch. The main causes of fibroid, if you're asking me, the causes of the fibroids are such not known, but they are in some groups, the chances of fibroids are more, especially in nulliparous women, and in some race it is more. बट दे आर बेसिकली नो कॉजेज कि ये खाने से या ये पीने से फाइब्रॉइड होता है, ऐसा कुछ भी नहीं है. फाइब्रॉइड्स किसी को भी हो सकता है, एंड इट इज एसोसिएटेड विथ रिप्रोडक्टिव एज ग्रुप. दैट मीन्स fibroids will not be there when you have no menstruation. 13 या 14 साल की उम्र जब तक आपको पीरियड्स शुरू नहीं होते, फाइब्रॉइड्स नहीं बनेंगे. और एक बार अगर आपका पीरियड्स बंद हो जाते हैं, तब भी फाइब्रॉइड्स का साइज डिक्रीज हो जाएगा और नया फाइब्रॉइड नहीं बनेगा. You cannot get rid of fibroids completely without surgery, but obviously हम decrease कर सकते हैं fibroids का size with the medications. आपको 3 to 6 मंथ्स के लिए हम मेडिसिन प्रिस्क्राइब कर सकते हैं, जिनसे कि देखा गया है कि ऑलमोस्ट 40 to 50% जो फाइब्रॉइड्स का साइज है वो डिक्रीज हो जाता है. लेकिन उसमें मेन ड्रॉबैक ये, आपके सिम्टम्स रिलीफ हो जाएंगे, आपका फाइब्रॉइड्स का साइज डिक्रीज हो जाएगा, बट ये परमानेंट नहीं होएगा. हो सकता है कि 3 से 6 महीनों के बाद ये फाइब्रॉइड्स दोबारा से ग्रो कर जाए या साइज दोबारा से बढ़ जाए, पर आपको कुछ टाइम मिल जाएगा सर्जरी से बचने के लिए. बट पूरी तरह से फाइब्रॉइड्स खत्म नहीं होते हैं किसी भी ट्रीटमेंट के साथ. सेफेस्ट वे टू रिमूव फाइब्रॉइड्स है लेप्रोस्कोपिक और रोबोटिक सर्जरीज. चाहे हम मायोमेक्टमी करें, चाहे हम हिस्टेक्टमी करें, द सेफेस्ट आर टू रिमूव इट लेप्रोस्कोपिकली. So I think that's all with the questionnaires. So thank you all for joining our video, and hope it was informative session for you. So please subscribe to our channel and Facebook channel, and please stay updated for the latest updates. So thank you again.